Most people with genital herpes may not know they're infected. In fact, in the United States, an estimated 87.4% of 14 to 49-year-olds infected with herpes simplex type 2 or genital herpes have never received a clinical diagnosis. Hi, I'm Dr. Katherine McGowan, an infectious disease specialist at Brigham and Women's Faulkner Hospital. Genital herpes, we've all heard of it. But what is it? Let's talk about it. Genital herpes, or herpes simplex type 2, is a sexually transmitted disease that affects men and women equally. Transmission may occur very rapidly in new sexual relationships, and this allows for more rapid, widespread infection. There are two types of herpes infections. Herpes simplex type 2, the usual causative agent of genital herpes, and herpes simplex type 1, which is the usual agent associated with oral herpes infections or cold sores. So how contagious is it? You're at greater risk for catching herpes with increasing age and increasing numbers of sexual partners. People think no symptoms, no herpes, but they could not be more wrong. Transmission commonly occurs from an individual who may not even know that they have herpes simplex type 2. They may not have sores or lesions or any symptoms that suggest genital herpes. This is why testing and treatment are so important. Keep in mind that 70% of transmission occurs during sexual contact with an asymptomatic individual. If left untreated, individuals can become quite systemically ill with fevers, sweats, chills, headache, and enlarged lymph nodes. If you do have local symptoms, generally the infection will begin as a vesicle, which is a small little bubble that then becomes filled with fluid and cloudy, and then ulcerates, erodes, and becomes an ulcer or a sore. The sores of herpes simplex are very painful, and this characteristic distinguishes it from syphilis. Once an individual is infected, the virus remains in their body, very similar to chickenpox. Recurrent symptoms occur when the virus is reactivated or triggered. These repeat symptoms, such as blisters, sores, splits in the skin, or red patches of skin, occur when the virus is being shed. And it is during this time that the virus is transmissible or contagious to others. 80% of individuals with herpes will have recurrences. But remember, not everyone has symptoms. Aside from being unaware when one has symptoms, oftentimes people feel guilt and shame with herpes infections. And this prevents prompt testing and treatment. But there's nothing to be ashamed about. Treatment is surprisingly easy, simple, and very highly effective. Although there is no cure for herpes, treatment is with a simple oral medication. Getting diagnosed and treated as soon as you are infected is very important because number one, it decreases the amount of viral shedding, and number two, it decreases the time it takes to heal these lesions and decreases one's pain and symptoms. It's important to know that herpes is manageable with oral medication. In fact, daily oral medication can decrease the risk of spreading herpes to other individuals. A lot of people want to know, if I have herpes, can I ever have sex again? The answer is yes, but I would recommend speaking with your sexual partner or partners about their risk. Condoms decrease the risk of transmission, but not 100%. In addition, I would speak with your healthcare provider about your concerns and the treatment options. Thanks for watching. I'm Dr. Katherine McGowan. For more understanding videos, click here. To subscribe, click here.